Hey folks, we're gonna get started here if people want to find a place to sit down. All right. Good evening and welcome to the Trailhead. I'm John Munger. I'm the executive director of the Lopet Foundation, and we are a nonprofit organization that partners with the Minneapolis Park and Recreation Board. Our mission is to get people outdoors and active, and we do that because we believe that good things happen when you get people outdoors and active. Kids are happier and healthier. We're all happier and healthier, actually. Kids do better in school. They do better academically. They do better behaviorally. People with obesity problems have those problems reduced, and rates of diabetes go down. And people can connect with each other across ethnic and economic lines in the outdoors. So we constructed this building in partnership with the Park and Recreation Board as a way of enticing people into the outdoors. And it does a great job with that, as you can see here tonight. There is another organization that partners with the Park and Recreation Board to help take advantage of the incredible park system that our founders left us here in Minneapolis. And that's the Minneapolis Parks Foundation. And the Minneapolis Parks Foundation is led by my good friend and partner in crime, the executive director of the Parks Foundation, Mr. Tom Evers, who will come up and talk to you. Come on, Tom.
All right, thanks, John. It's so great to be here in the Trailhead. The Lopet Foundation has done an amazing job in reimagining what Worth Park can be, and really building a community around this building and then bringing this building to life. And the Parks Foundation is learning a lot from how the Lopet did this, and our park system is something that is not stationary. We got to keep imagining it, and I think this is a great demonstration of that. And I know that as we're talking tonight, I'll be watching you'll be watching bikers go back and forth, and we'll know if somebody bites it because everybody will be like, ooh. But that's part of it. We're immersed in our park system. Again, I'm Tom Evers with the Minneapolis Parks Foundation, and welcome to the last of this season's Next Generation of Park Lecture Series. And this is a series that is, it's in its 9th year now, and it's really about bringing people to Minneapolis to talk about big ideas that are happening around the country and around the world, and using that to inspire new ideas for ourselves. I want to thank our presenting sponsor, Minnesota Public Radio, and and the Lopet Foundation for hosting us. And also we have sponsors ASLA Minnesota and Bar Engineering, who've helped supported this lecture series. These series are free and open to the public. They're for everybody to come, so spread the word. We want more people to come. And tonight is the last one. This speaker series it was really about how we expand our imagination. So we want you to take what you hear tonight and think with us forward. The Parks Foundation, just briefly, we're an independent nonprofit, and we know that parks transform lives. Whether it's kids who learn lifelong skills through the Lopet Foundation and their programming, or the other park programming throughout the system. It's through families who get to know each other while standing next to a playground or at softball or baseball games in their neighborhood. It's through the surprising power of connecting with nature in surprising ways as you're standing on the river and see an eagle or a heron. They really transform our lives and make us feel like we're part of something bigger. And regardless of how you come to our parks, we know that your life can be transformed through them. And so tonight, we're really thrilled to bring Dr. Zarr here to talk about what he's doing, because there's some real science and real benefits that he's tapped into to talk about how parks can be used in medicine and people's health and well-being. And he is going to talk about his personal commitment to savoring all that parks have to offer and how it's led him to chart a new approach. And I hope that after tonight, there's doctors in the room and other medical professionals. This is something we want you to take back. And it's fitting tonight that Minnesota Public Radio is our presenting sponsor. They've been great at each of these events. If you've been to them in the past, they really elevate the conversation. So after Dr. Zarr's presentation, then Elisa Roth will be sitting down with him to expand on the conversation. Elisa is Minnesota Public Radio's mental health correspondent and has been centering her reporting on the issues of mental health and well-being in Minnesota as part of NPR's broader effort to expand our understanding of how mental health care and wellness is sought and provided. I think it's really profound what that Minnesota Public Radio is pursuing this. And so she'll take a little more time to introduce Dr. Zarr, and then Dr. Zarr will present, and we'll have some conversation afterward, and really just invite you to sit back, relax, enjoy it, and thanks for coming. Now, Lisa.
Thank you, Tom, for the introduction, and thank you to all of you for coming out this evening. I can't think of a better place to have this event, not just because we're in this beautiful park, but as many of you know, the Trust for Public Land named Minneapolis #1 in the country last year for giving the most people access to good parks. St. Paul was a very close second. I'm new to the Twin Cities, so I have no skin in the game yet. Our speaker, on the other hand, may have something to say about those rankings because Dr. Robert Zarr comes to us from Washington, D.C., which ranked, I think, #4. Dr. Zarr is a pediatrician in Washington at a clinic that serves low-income and immigrant populations. He's the founder and medical director of Park RX America, which is a community health initiative that prescribes nature to patients and their families as a way to prevent and treat chronic disease and to promote wellness. He's also served as the Park RX advisor to the National Park Service. So please join me in welcoming Dr. Robert Zarr.
So thank you so much for having me, for hosting. I'm just overwhelmed with all the kindness and generosity in the last, 8 hours so far. I'm actually coming back to Minnesota next week for my nephew's graduation from med school. I'm sorry to say, not here, but in Rochester. But I'm coming back. And it's my first time actually to be in Minnesota, which is today. I'm going to jump in and share with you some of my own experience. As Alyssa said, I'm a practicing primary care pediatrician, and I see patients usually 5 days a week. And about 10 years ago, I heard Rich Louv speak, and he wrote several books. At the time, he had written Last Child in the Woods, and I heard him speak not at a place like this, but at a place full of pediatricians, the American Academy of Pediatrics annual meeting in San Francisco in 2010. And I was blown away. I went back to DC and I thought, this will be a cinch. I'm just gonna go and I'll look up all the parks in DC and we can start prescribing. Makes sense. So 10 years later, we're still figuring it out, but I wanna share with you some of the figuring out that we've done over the last 10 years. When you think of nature, maybe not you, but when people think of nature, they often probably, in many cases, think of the Grand Tetons or Yellowstone, and this isn't so bad right here either. But there's also nature very near to us, near in proximity, near in other ways as well. So I put up here one of your parks, and that's to remind us that it doesn't have to be far away. It doesn't have to be that once-in-a-lifetime trip. Now, anybody seen this nature pyramid? I see quite a few hands. Fantastic. I really like this infographic because it sort of encapsulates a lot of what I'm going to share with you. It's a pyramid, so at the very top is that maybe once-in-a-lifetime experience for many of I'm a pediatrician, so it doesn't bother me. You can scream all you want. I don't even hear it. At the top of actually a funny story, I was working in the nursery when I was a resident, and my wife, when I were talking, and she's like, what is all that screaming in the background? And I was like, what yelling? What crying are you I really didn't hear it. It might have been 2 in the morning as well, but it didn't help. At the very top of the pyramid is that once in a lifetime. Now, for my patients, so low income, immigrant, people living in Washington D.C., if that echo continues to tell me I'm okay. Okay. They may never get to Yellowstone for many of them. They may never even get to the Blue Ridge Mountains, which are only an hour and a half away. They may not even get to, one of our national parks that's 20 minutes outside of DC. So it's important to remember that intense experience that's maybe once a year for maybe us, maybe once in a lifetime for somebody, maybe never is important, but that's not the work that I do. The work that I'm doing is at the very bottom of the pyramid. And that is what we saw in the earlier slide, right? These are the parks, your gardens. It may just even be a tree right outside your backyard, or for me, my back and my front. So I don't really have a yard, but I have a deck, and through it grows probably about a 60-year-old willow oak. And that tree is very dear to me. I mean, that tree is so important that I have, rebuilt the deck around it, and I told my contractor, if you kill this tree, I don't want the deck. So don't kill the tree. So I got an arborist involved, and we did it the right way. And he or she, I should know that, is very healthy. So at the bottom is that really accessible and frequent experience that we probably should, can, and should have during the day, every day. Some say hourly. This is unfortunately how most of us actually live our lives, right? And even the best in this room do some of this. In DC, it seems to be a lot of this. So we sit a lot, we're on our electronics a lot, we don't eat very slowly. What we do eat is not always the best food. We have a lot of chronic stress. And when we have all those things, we take it to our doctor or our nurse practitioner or trusted health professional, and they often give us pills and procedures and referrals to see specialists. Am I summing it up about right? More or less. So here's a quick view of the epidemic. I call it an epidemic of chronic disease. This is what we're dying of in this country and in many places around the world. And it's driven largely by what we do and don't do every day, right? Now, yes, there's genetics, there's other factors, there's environmental factors, clearly, but this is not talked about enough. Now, I pulled this is the Centers for Disease Control and Prevention top 10 causes of death. And if you go, toggle between these two, it's gonna make you dizzy here a little bit. But if you do that, what you'll see is that either directly or indirectly, each of these issues that I just pointed out here is related to these. If you think about it, we could go through one by one, which we won't do, but just some food for thought. So this brought me to learning more about the correlation between time spent in nature, which could be recreation. I'm a big fan of recreation. I used to mountain bike. I still bike a lot. I walk a lot. I hike. I canoe. I do all that stuff too. But it's not just about recreation. It is about time spent outdoors. Now, we know that spending time outdoors, you're more likely to move, and that's really important, among other things. And there are things that happen to us when we're outdoors. Now, more may happen if you unplug, right? So when I write prescriptions, sometimes I'll add to that, buds out, take the buds out for that 30 minutes or that hour, so you can hear and you can focus on things other than what's coming through your phone. We know that anxiety is improved. We know depression is improved. We know this rumination or this persistent negative thinking improves. We know that focus and attention, so there's the attention restoration theory that your focus tends to come back. I know that even just colloquially we say, just go out and take a walk, take a 10-minute walk or a 20-minute walk, clear your head and come back, right? We say that. And there's actually science to back that up. That actually does happen. So when you think about how much we tax ourselves every minute of the day with our phones and with all of our emails and our checklists, and we're doing good things, right? We're creating park space, we're creating programming, we're not busying ourselves with a nonsensical activity, but it's still very cerebral, the work that we're doing. And if you put a little bit of nature into your day, Rich Louv, as I've heard him say, and he said in his book as well, that with the more technology in our life, the more nature we need to balance it. And I might add, with a more cerebral life we lead, the more temporal, in terms of your temporal lobe, the more sensory life we need to lead to balance it out. There's something called forest bathing. Has anybody heard of this? Forest bathing? Oh, of course. Well, we're in the Twin Cities, right? Anybody been on a forest therapy walk? Anybody been on a forest therapy walk? One. Where did you have? Do you mind me asking where you had that walk? I give them. You give them. Okay. All right. Wonderful. I won't do that anymore. I actually just went through an 8-day training through the Association of Nature and Forest Therapy myself. So I'm a guide in training. And so I learned a lot about forest therapy in 8 days. And I'm bringing this up because I was really intrigued with the science. So in Japan, I think it was about 1981, this term forest bathing or shinrin-yoku was codified. So, and it has sort of a double meaning to it. It means, and you can correct me if I'm wrong on this, since I'm in my practicum still. But it means literally like bathing your senses in that area where there's some natural element, often a forest. But it also is very literal in the sense that trees, and in Japan, when they did these studies, it was cypress and pine trees, they actually emit these things called phytoncides. And they're chemicals that help keep the trees healthy, they fight fungus, bacteria. Well, they also help us. And interestingly enough, one of the studies looked at natural killer cells, which are part of our immune system to fight. One thing that we do is it helps fight cancer, right? So these cells roam around in our body and they find abnormal looking cells and they can take care of them. So what they found was that after a 3-day excursion, 2-night excursion into these forested areas, that the natural killer cells went up about 50%. And they stayed up in your body 1 month after, as high as 24%. So very interesting stuff going on here. Like, who would have thought that a walk in a forest would actually boost your immune system? Well, it does. They also looked at stress cortisol levels. So they swabbed the buccal mucosa before and after. So a lot of the studies are like before and after, maybe not the finest NIH methodology, but very interesting and intriguing data that came out of there. So sometimes I prescribe as my prescription a forest bathing-like experience. Sometimes I'll go so far as to refer them to a guide. So not usually myself because I'm in the office, but we've actually taken our staff, our nurses, our social workers, our doctors on forest therapy, a 2.5-hour walk instead of the indoor meeting. So I mentioned earlier that this conversation a little bit about activity, because a lot of folks think that park prescriptions are about being active, which ends up being the case for a lot of people, but not for everybody, right? But just to keep in mind that being outdoors does confer a higher probability of your moving. That's interesting, right? We also know from some studies that green exercise, or that is moving outdoors, confers some mental health benefits that you don't see with moving indoors. So the gym versus the fitness, outdoor fitness zone versus, or even just something outside, walking outside versus walking on a treadmill, right? I did a study in 2013. This is when we went live with the first electronic version in DC for prescribing parks. And I wanted to see whether a prescription itself would increase the likelihood, this is in children, of visiting a park, being in parks, and moving more. And I was pleased. It's a small study, 212 participants, but we published it and we found that it did. So that was very reassuring to me, because there's a lot of science out there. If you want to see the science, you should visit the research library online of the Children and Nature Network. So there's over 800 studies, and at least half of them, if not more now, are focused on health outcomes as it relates to nature, being outdoors. So I'm pretty convinced that there's a strong correlation, and so are many, many dozens and dozens of researchers around the world. But what I wasn't convinced of necessarily was the prescription would result in a behavior change that would then make that deduction in your mind that maybe, in fact, the park prescription does result in improved health outcomes. We still don't know that as well as we should, and there's research that's going to be happening in the next 10, 20 years. We actually just got awarded an NIH grant to do that. So we're going to be doing a randomized controlled trial where I work, and the participants will be children, looking at several different measures, so including physical activity, including diabetes and mental health. The second study on there I wanted to point out is a randomized controlled trial done by Dr. Razani, who's another pediatrician out at UCSF. And she had two groups of kids. One group got just the, plain park prescription, kind of the way I do it, more or less. No bells and whistles. The other group got the park prescription plus the guided experience through, nature, right? They got the photographer, the food, the transportation, the guide, all that stuff. And she was looking at stress reduction. What she found surprisingly was the group that didn't get the bells and whistles did just as well. Don't know exactly why yet. So this brought me to Park RX, actually brought me to DC Park RX, which is where we started. That's where I still live and work. And the idea seemed to be picking up enough speed in a number of places around the country. They wanted to get their parks on our platform. I said, maybe we should rename ourselves. So we chose the name Park RX America. So the idea really is that we have a platform that can make sure that health professionals and even now educators around the country can know that there's a solution beyond pills and procedures, right? I don't stop, I still do that. I'm still a doctor. I still practice and I do the things you think I do. But I also do some of the things that you probably don't think I do, right? Which is putting into practice the science and evidence that supports prescriptions in nature. So when we went one step further, we provide a tool to do that anywhere in the country, as long as there's an interest and willingness on the part of the professional to prescribe, as long as there's the risk of chronic disease or the presence of chronic disease, and as long as there's access, relatively good access to green space, which isn't true everywhere in the country. There are plenty of places with park deserts, right? But in many places, I can tell you, we have those three ingredients and we're not prescribing. So one of my mission is to get those places, that low-hanging fruit areas, up and running. If I may, I might just play you just a tad bit of this. Park RX America.
Feel happy because when I go outside, I get some fresh air.
These are not actors.
Yeah, I think if I'm too long inside, I get a little wound up.
There's something very spiritual about, the trees and, the leaves,
the animals, the crickets,
the birds, the soil,
the rushing sounds of the water, just sitting still, closing my eyes, taking a deep breath in.
I find that very, very comforting.
A lot of benefits come from being outside and being in nature.
That was a testimonial we did. It was National Public Lands Day in Rock Creek Park. But I just thought I'd give you just a little glimpse of some of the things that come out, people are interviewed, on that special day. Let me see if I can get this to advance. There we go. So, just to give you before we move on to the next section, you may still be wondering, what the heck is a park prescription? I haven't really told you yet very, very well. The idea of the park prescription started in Australia at least 2 decades, maybe more decades ago, as part of Healthy Parks, Healthy People. And so when that happened, there was some interest around the world, and Australia, being very generous, sort of said, take it and run with it. So we have now a U.S. National Park Service, Healthy Parks, Healthy People, of which part of that is the Park RX, or the park prescription. Now, the RX is very important to me, and I think to you as well, because it's a symbol that represents something kind of serious, but can be changed to be very adaptable to the situation. The park, I think, is obvious, although I've had many deep conversations about what a park is and what constitutes a park, how natural does it have to be a park Can a playground in the park still make it a park? And on and on and on. But let's be flexible with the term and think of park as a surrogate for green space or a natural area. Could be a beach, could be a desert, right? Somewhere where there's some natural elements to it. And the RX is the prescription. Now, for years, I was like, it doesn't have, I mean, you do what you want with it. Very flexible. I grew up in Austin, right? I mean, whatever. Do what you want with it. But what I kept getting was, but what is it and how do you do it? And then people were getting a little bit stumped by this, right? So I said, okay, let's take the RX and run with it. So when I write a prescription for amoxicillin or some medicine, I don't just say, hey, look, you just go and take it as often as you want, as many, take 5 cc, 20 cc, I don't really care, as long as you want, and I'll just see you whenever. If you have a pneumonia, I don't do that, right? It's 10 days, it's twice a day, it's a specific dose, there's a taste to it, there's side effects to it, so it's very specific, right? For a reason, right? Because you need to know what you're supposed to be doing. So I've modeled the PARC prescription off of a medication prescription. So there's 4 ingredients to it. One is that it has a place. That's really important. You're like, why is it so important? It's important because if you don't have a place, right, you don't have commitment. So I often ask my patients, where and what do you like to do outside? It's a simple question. And the answers are amazing, right? I find the open-ended questions are really, you get really interesting answers back and answers I can work with. And when they answer that question, I've got the first 2 parts of my prescription already. I've got place and I've got activity. And it ranges from I like to lie in my hammock in my backyard to I like to play basketball or I like to go for walks with my dog. I mean, it's on and on and on and on, right? So for me, that's good because the patient family is driving the prescription. I'm not really writing it. I'm sort of guiding it, like an ANFT guide, right? The next 2 are, how often are you willing to do this and for how long? And that's where I kind of do step in a little bit, put on my doctor hat, right? So if someone says to me, oh, I go some of the time. Can you be more specific? Like, what can we commit to? Okay, how about 1 day a week? Which day of the week? Right? Saturday. Okay, that's good. And you think you can do this walk, with your buddy on Saturday and every Saturday pretty much? Yeah, I can do that. Great. And then I might say, for how long? Right? And if they say, how about 20 minutes? I'm like, it'll take you 20 minutes to get to the park. How about we up it to 40? So there's a little bit of motivational interviewing going on there. This is a job that we do, right? And I'm done. I've basically written a prescription. I've done it now. And by doing it that way, it's involving your patient, your client, your family right there with you. Now, if it's a kid I'm dealing with, and I love just talking to kids directly. We're usually down here. But you have a parent or someone in the room, a guardian with them, right? So the kids are sort of the opposite oftentimes. And the younger the kid, it's like, how often do you want to go to the park? Every day. And the parents are like, I'm not going every day. We'll go twice a week. And then I'm like, how long do you want to be there? And they're like, 5 hours. And the parents are like, we could do it for 1 hour. So depending on, who, with whom you're having this conversation, your prescription starts to take shape, right? And then I say, would you like a reminder? And they almost always, I've never had a no yet, say yes. So I can send them a text or an email right there and then. We usually opt for the text because what happens when you send a text? It dings, right? Ding, right there in the office within like a second or 2. And so I say, please take out your phone and open up your text. And they open it up. Click on the link. They click on the link. And they see the park that that place we just talked about. They just told me they like to be there. They feel safe there. They like to walk their dog or whatever they like to do, but aren't doing enough of it, right? And there's a little green button that says, yes, I filled my prescription. Bingo. Click that button every time you visit and you fill this prescription. And that allows me then to have a record of it, right? So when I see them in a month and I say, when do you want to come back? I let them drive a lot of this stuff. This is how I teach this stuff. And then they say, how about a month? How about 2 weeks? If it's a kid, they're like, how about tomorrow? I'm like, no, tomorrow's too soon. So a month, let's say, or 2 months, they come back. Then I have a record, and every single prescription has a unique code to it. So with that unique code allows me to track it and for them to respond to that prescription. So I have this dialogue that's sort of happening between visits. This is very important. So the other day I had this kid I saw and he went 13 times. He filled his prescription 13 times. And he didn't gain weight, by the way, although that was not the goal. And I walked in smiling to the room and he saw me smiling and smiled, that mirror reflex sense. And we knew right away why we were both laughing, because he did it. He changed his routine, right? Very, very powerful to walk in with some information, to walk in with some data about something positive. We have something on the right side of the chart, usually it's the right, called the problem list. Where's Brian in the audience? I know there's at least one other doctor in the audience. He's somewhere in there. He's also a pediatrician. But we have this thing called a problem list. We think about you as problems. It's terrible, right? The 42-year-old with hypertension, diabetes, and depression. My God, I mean, that's how you think of your patients, right? So it's also the prescribing of nature and talking about nature deficit or routines. It's fun. And I have found that even among the doctors and nurses who are doing this now, physical therapists, whatever, they enjoy it, right? And so do their clients and patients. It's a very positive thing to be doing. So, where are we now nationally? We have nearly 7,000 parks in our platform around the country. I'm happy to say with Ariel's help with the Department of Natural Resources for Minnesota, we have 76 state parks already in our platform. We're hoping to get the 186 municipal parks in very soon. We visited North Point today, the Community Health Center. There seemed to be a lot of interest there, I'm hoping, as well. So we'd love for Minnesota to light up even more, and I can show what that looks like if you want. We have 40 states with parks and prescribers now. We have over 300 prescribers around the country, over nearly 1,300 prescriptions. And the fill rate is how many of those prescriptions, unique prescriptions, have been filled at least once. Now, I'm happy to say mine are about 50, 60%, so I'm really proud of that. But even the low end is 20%, right? So really encouraging that once we get somebody up and prescribing, and it's a daily routine for this health professional, it sticks, it seems to stick. And people start, the clients, the patients start to actually do it. So that's a bit of a glance what that looks like. I kind of went through all this already a little bit. I don't want to bore you with it. I didn't want you to look at the screen, so I just kind of did it without the screen. But this is a glimpse at the electronic health record. So at the very, very last step after I prescribe it and I send it and it's on their phone and they click it and they open it up, I push a little button that says copy text and I paste it into a treatment window. This is boring stuff for you, I'm sure, but it's tagged to a diagnosis. So I know why I prescribed it, okay? In this case, it was done for obesity. Okay? Now, sometimes it's obesity, hypertriglyceridemia, depression, a lot of things. So I just copy and paste in every one of those because, hey, the science is there. It actually treats every one of those things, right? So very exciting. It's a way for us to minimize the amount of work and typing and checking of boxes and all these things that doctors hate to do. So where are we with our future? I mentioned already, we would love to have more parks in our database, both here in Minnesota and throughout the country. There are clearly over 100,000 parks in the country. And mentioned earlier was the Trust for Public Land. So we're working with a lot of different agencies, locally, statewide, even nationally, to get that data in. Because remember, if I don't have that park in my database, it's kind of hard to prescribe. I got to have that placed in. And you may think, why do you have to have it? I have to have it. Because when I'm seeing my patient right there and then, and I can see where they go virtually, right? I can see that tree or that bench or that playground or whatever it is that they know, but I can't know because I can't know every park. It allows me to connect to my patient by virtue of this photo of that park that's their park and their place. So it brings to life something that's really important. So place is actually important. Now, sometimes I have a patient who says, well, I blind my hammock in my backyard. I'm like, okay, that's not a park. So what I do is I find a park nearby them, and I can do that with my platform, and I prescribe it that way. And when I go back and paste it, I can modify that to reflect exactly what they're doing. So I erase the park, and I put in backyard of dad's house, for example. So there's even that kind of customization that can happen. The next thing is to have these less traditional users, right? You think doctors, doctors, doctors. No, there's social workers who've signed up and are prescribing. I've got physical therapists, psychiatrists. I even had a podiatrist come to me. Why a podiatrist? Anybody? And what do they see all day? Feet of diabetic patients, right? I had ophthalmologist friends say, Robert, why should I sign up for this? Why should you sign up for this? Have you not seen the data on myopia? There's an epidemic of myopia because if you stare at this for 16 hours, what happens? You can't focus out there anymore, right? So there's a lot of things that are happening you wouldn't even think are related to all these specialists. Well, lo and behold, they are, right? The third is technology. So the world of medicine, of health delivery is changing very rapidly. One of the things that's changing very quickly is electronic health records, right? So now it's everywhere. Not everywhere, but almost everywhere. So I went with this model after a lot of thought, a lot of trial and error to make it universal. So our platform allows you to use any electronic health record and put it in your clipboard and paste it into your treatment plan no matter what you use, which is very, very important. The next step, once we get nationally all those parks in, I'm looking at our park professional experts, managers in the room, then we can take that to the EHR vendors, electronic health record vendors, and say, let's make it a peripheral lab. So anywhere in the country, imagine this, right? You're working, you're a nurse, you're whatever you do for your living, and your company, because you don't really work for yourself much anymore, you work for a company delivering healthcare, has their EHR, and that electronic health record already has our platform embedded in it. So you don't have to go anywhere, you have to go to our website. It's just there for them to use. Even the current peripherals, one is called Up to Date. It's a way for us to get up-to-date information about treatment, about diagnosis, things like that while we're seeing patients. Even that takes you to their platform, even now. So what we've done is the step right before that. The second to last thing for us to be able to do, and this is really important because I went to North Point today talking to the pediatric group, okay? So it wasn't just pediatricians. It was the nurses and the medical assistants, everybody in one room, about 50 people. And I saw a lot of this in the room. Fatigue, exhaustion, people are tired, And what I'm learning is that among the health professionals, there's fatigue, there's mental health problems, there's chronic disease, there's suicide. We have about one doctor a day in this country kill themselves because of suicide, right? So it's bad, it's an epidemic. And it's not reasonable, I've decided, to expect these fatigued and worn out health professionals to prescribe nature when they themselves are working in these nature void areas called hospitals and clinics and health centers. So we need to think about bringing greenness to them, windows, natural ventilation, sunlight. Naomi Sachs has done some research on this, among others, and done some good research to show that the health care providers and professionals do better and are actually more productive and call out less sick days when they have some nature in and around where they work. The last is evaluation and research, and I hinted at that earlier. There's a lot of good research out there, but we need more clinical trials. We need to better understand the prescription itself. And I think the grant that we just got awarded from NIH is a great start, but that's just the tip. We need to have much more better understanding of subpopulations, different kinds of prescriptions, therapeutic index, on and on. So I'm going to stop there because I could go on forever because I probably already went over. And thank you for your time. And I think we're going to continue this conversation. So. Are we moving this table?
Yeah,
Okay.
Thank you so much for that. It was so interesting and fun. I think we're going to circulate with cards. Is that right? So that if you all have questions, you can write them and pass them forward, and we can add them to the conversation. I'm curious, when you have a patient and their parent or their guardian, and you prescribe outdoors and park, what do the parents say?
So I oftentimes find that I'm talking to my patients directly, even if they're like 2 days old, right? So that pediatricians are, is what we do. So sometimes when we start having this conversation, I realize that I'm leaving the parent out a bit too much. So I try to be wary of that. But when the conversation starts to happen and we get that prescription starting to take place, that's oftentimes when the parents are like, 5 days a week or 7 days a week? Can't do that. And so that's usually an entry point. Surprisingly, I don't get a lot of, rolling of the eyes and like,
write me a real prescription, please.
I don't get it. I don't get it. And granted, I've been at my practice for 18 years, so I know my patients well. They know me well. We have a trusted relationship. And I've written about this as well, that I think that that's important. Having trust, your relationship based on trust is the basis of anything that's going to be successful. So the fact that your primary care or even your intensivist, if you're in the ICU, whatever is going on, if you trust that person and you're a trusted health professional or your educator or whatnot, that's when you don't get the, what? What are you talking about? So I don't really get that. And I think there's also some just intuition going on here. I think people in general recognize that something's missing in their life, right? And they maybe couldn't put words to it. But when I was a little afraid initially of using words like nature deficit with my patients, right? Or nature, deprivation, or, relationship with a tree. These kinds of things I ask them. And I've just said, the heck with it. I'm just going to use them and see what they say. And even those don't get a lot of crazy eyes. They're like, okay, yeah, I could see that.
You obviously have a focus on kids and kids getting to the parks. How about the rest of us? I mean, are we going to see the day when our grown-up primary care docs are telling us to go outside?
So I have said from the very beginning that even though I'm a pediatrician, I have most of my colleagues are family medicine docs. I have a lot of internists I work with, nurse practitioner, physician assistant. So even my growing up in my practice, I have had a lot of exposure to adult medicine. And we've opened the platform. We've never limited it to children. So it's open to any age. And Tom and I were talking earlier today about the importance of play in children. Right? There's a lot written about why play is important in children. And I think we need to start writing about why play is important in adulthood. I don't think we play enough. Our societal norms are that once we grow up, we're done playing. We have to be serious, right? And through my work now through the Association of Nature and Forest Therapy and forest bathing, a lot of the invitations that we do, they're playful, right? And wow, when I do that, when I participate in doing that, I feel so different when I hear we do a thing called counsel, so we share the experience with each other. That's often what you hear too, is that was just fun to be able to have this, non-judgmental, free, liberating, playful experience that we could do. No one's stopping us from doing it. So absolutely, it's not age limited.
I'm going to open it up to some questions here from our audience. What do you think of prescribing traditional sports outdoors for kids or adults to address these chronic health issues?
So I'm all for sports, right? I'm not a triathlete, by the way. I might have the physique of one, according to an article that was recently written. But I really do. I believe in the flexibility of the prescription. So the way I think of it, the prescription, the RX, is that it has structure to it, right? So it has those 4 ingredients. It has place, it has activity, it has dose, it has frequency. But within those parameters, absolutely, right? So if I have somebody in front of me who says, I, want to join a team and play X sport, okay, great. And I might actually, I had a child a few months ago who I asked, what do you like to do outside and where do you like to do it? And he said, well, I like to play soccer, but I don't know where to play soccer. There's no soccer field where I live. I was like, boy, you're asking the wrong person here because I'm going to tell you where you go. So I looked up on our platform with a matter of seconds. I thought, well, that's funny. there are 4 soccer fields within 0.8 miles of your house. So the prescription for him was explore the soccer fields, once a week for 4 weeks, come back and tell me about them. So I'm all for what seems achievable. One of the things that I've realized over the last 18 years is what's more effective in my practice certainly is to not tell people what to do as much as it is to listen and try to figure out where they are in their ability, willingness, perceptions to get somewhere that we can get a goal achieved. Sometimes the goal is very simple. Fill the prescription, right? It's not lose weight, it's not feel better, right? And the goal could be, as I said, explore your neighborhood park for 30 minutes twice a week. And they've driven that, right? So I might modify it here and there, but I think if somebody says they want to do sports, that's great. So I might add to that we need help from the park agencies with all of the incredible programming that goes on. So we haven't been able to do that quite yet. We would love to demonstrate to the world that we could seamlessly connect the programming through our platform, through the prescription to our patients. So if they say, I want a yoga class outside, or I want to do this particular thing outside, and you offer that, I want to actually put that in the prescription and identify that very quickly for them.
Persons of color will make up it'll make up a large percentage of the population in the future, but make up a minority of park users. What are your suggestions for overcoming barriers, whether it's lack of access to transportation or parents working multiple jobs, safety in some of the outdoor spaces?
So being sensitive to your clients, your community, where they come from, is, that's like basic, right? That's what we should all be doing. How best to answer that? So I hinted earlier about it's a prescription, but sometimes being less prescriptive is a good thing, right? Listening to people. And I'm a firm believer in asking a question and listening, because that's what really drives everything. So by asking where and what do you like to do outside, no matter where your patient is in their life, it can give you a lot of information, right? So I'm in an office setting. I work at a community health center that's part of a federally qualified health center, been around for 20 plus years. I see a very low income population, almost entirely of color, very immigrant. Add to that all of the social stresses and the chronic stresses and the toxic stresses in their life, just to give you a picture of what I do every day, right? So when I went to North Point today, I was getting a little bit of that, well, our patients, our community is there's crime and there's bullets flying through the air and, getting a lot of the negativity, which I know is warranted. It's there, right? And there's some bad things happening, but also in my neighborhoods. And what I've realized is that, the communities who are suffering the most need nature the most, right? And it's not nature or food or nature or good education. I mean, I'm not saying that. I'm not saying nature only, right? But what I am suggesting is that open your eyes and your ears to what you're hearing. That's what we're supposed to do as physicians or trusted health professionals. Listen to them about what their stressors are, where they're coming from, what they're willing to do. And you'll be surprised. I'm surprised every day about what I hear, right? People can make some time because they're spending their time doing something. And oftentimes, even if you're poor, you're of color, you live in an impoverished neighborhood, I can go on and on and on. That's what I see every day, right? You could still be on your phone for 3 hours a day or 7 hours a day or 10 hours a day versus going outside to a park that actually is safe, doing something that you want to do, but maybe just a little bit of push, a little bit of encouragement. So Yes, I encourage walking to parks or taking human-powered transportation to parks. Yes, I encourage, from the bottom of the pyramid, parks that are accessible and close to you, right? So another reason why you ask your client, where do you like to go? Where is your park? Now, sometimes I go, well, I like to go to the one across town. We got to drive there. That's great. Keep doing that. But where is the park that's close to you that you like too? They'll tell you. And even when you think, oh, they don't speak English, they don't speak, they're not fluent in this or fluent in that, you'd be surprised how many people of color, low income, immigrant, just showed up, actually know their park. People still do walk, They do know where they live. They may not be spending time in that green space in a way that's therapeutic. They might be on their phone the whole time, which is why I was saying earlier that if they say, oh, I like to, be on my phone and chat with my girlfriends, for half an hour, can I do that for my prescription? I'm like, well, no, but you could do it afterwards, So there's a little bit of adjusting in there to make sure that the prescription is going to be more therapeutic for them. That's where we come in to do that.
You talked about talking about what a park is and how we define a park. So riffing off what you were just talking about, does it matter if it's a space like this or if it's like a New York City playground where there's play equipment but no trees?
Well, it certainly matters. It matters more to the person than to me necessarily, right? So there is clearly some science that's looking at where that therapeutic index is, right? So Dr. Strayer is, taking vets out and doing these 3-day excursions in Utah and attaching their brains to heads to EEG electroencephalograms and measuring brain activity and seeing where, you can actually watch day 1, day 2, day 3. You can watch how your brain transforms, day 1, day 2, day 3 in these excursions. So there's a lot of great stuff happening out there. And I love that stuff. I love the science, okay? But I'm a primary care pediatrician. Come back to my simple world. So what I have to do is be very pragmatic about it. So if there's a tree, I got to figure out, my goal is to figure out, is there a nature deficit in this person's life? A little about their routine. That helps to know what they do, where they go, how they spend their time, and what they're kind of willing to do, right? And if they're willing to sit in their patio, so when I see a 2-day-old, does the 2-day-old need some fresh air? And the mother or father, some vitamin D, some fresh air, some sounds of birds? Yes, it's a good thing. And if they're gonna go as far as their patio, because a lot of my patients live in apartment complexes, and there's oftentimes a patio like that's inside of that complex, that's fine. If they feel comfortable there and they're willing to do that, that's the prescription. So, is it as therapeutic as sitting on the creek bed in Rock Creek? Probably not, but it's not going to happen. So being practical about it in the context of good science is how we operate.
You talked about doctors saying, my patients can't go outside, there are gunshots flying and whatever else. What are the other barriers that you see from the healthcare professionals?
From the professionals, okay. So I mentioned earlier the fatigue and the lack of exposure to greenness during the day. I think that's an important thing to consider that's not very often considered. So if you think about the environments in which health professionals work, think about the environments of a lot of schools, maybe not here in Minneapolis, but in D.C., we have a long way to go still. So a lot of the schools look more like jails and prisons. They look like schools, outdoor schools. So if you look at some of these environments, I think you'll have a better understanding of what the barriers are. So just lack of exposure to greenness. It's not that hard actually to get a living wall done, but it takes kind of understanding that there's importance to this and prioritize it and make it happen. Another barrier is very simply routine and behavior in the health professionals. So for example, I have made it my routine that I never let a day go by when I see patients, and that's pretty much every day, that I don't write a prescription. Certainly it's not for lack of chronic disease, right? And so a lot of this is developing good behaviors, both for the health professionals in their own lives, but also in their practice. So making it easy is one thing, but having reminders is really important. So we have done these focused interviews 2 summers ago with 20 of our prescribing health professionals. And what came up time and time again was, we need reminders. We forget to do it, right? I know. It's like, that's all you need? Sure, we'll do that for you. So we made bookmarks and we put them on the computer so they would always see it there. Getting plants in the rooms are really good things. So some visuals are very helpful. If you want to get fancy about it, some folks are like, putting in the electronic health records things that pop up, but that can get a little annoying and fatiguing as well. So carefully designing environments that remind you that this is something that you could incorporate into your visit. Oftentimes I'll have health professionals tell me that they don't have time to do it. And I say, well, you're counseling anyway on diet and exercise. They may not be, but let's just think positively, right? Let's presume that they are. Right? Raise your hand if you're a doctor or someone, your primary care person has talked to you about diet and exercise in the last 10 years. Right? Everybody's got to raise their hand. I hope. But it's a matter of how you do it, right? So that's what I'm suggesting to them is, rather than saying, listen, Robert, I need you to eat better, move more, I'll see you in a year. What happens to them? They come back in a year, and typically, in my patients, they weigh 20 more pounds. Right? And they haven't changed anything. So what I'm trying to do is give the 18 million health professionals in this country a way to do their job slightly better and give them the prescription which everybody understands. The patient gets it, the doctor gets it, it's there. It's a language we speak, but it's a language that's incorporating a lot of science and concepts that they may not be familiar with.
And the insurance companies can't deny coverage for it.
So I get asked a lot, am I going to get reimbursed if I do a PARC prescription? I'm like, well, I've never not gotten reimbursed. And it's not that I just say, welcome to your visit today. Today is about PARC prescription. We're going to prescribe you a PARC today. No. No, it's never like that, right? So it's in the context of a larger visit. It could be a well-child visit. It could be for, a chronic disease check. I call it chronic disease management check, right? To check blood pressure, whatever. So I'm doing what I do, and it's a matter of just incorporating that into my practice. So there's no reason to deny that. I've never had a denial for writing a PARC prescription. But I might add that insurance companies should be paying for entrance fees. Right? Many states have entrance fees for their parks. What if you can't get there? What if there's a park desert where you live? They should pay for transportation. Medicaid pays for transportation to a doctor or a hospital if you can't get there, right? So why shouldn't they pay for your transportation to get to the park, right? Or equipment. What if a poor black child, in D.C. wants to do ice skating and there's no ice skates? Insurance should cover that. I mean, there's equipment issues, transportation issues, entrance issues that should be covered. So if you ask me, right, I say cover it all. You're preventing and treating chronic disease, which is bankrupting us. 80% of every dollar spent on healthcare delivery is spent on managing chronic disease, if you didn't know that. It's a lot.
Here's a question about chronic disease that's near and dear to my heart as the mental health reporter. Are psychologists and psychiatrists prescribing PARC time?
Yes and yes. And therapists and social workers, and there's a much broader field of mental health provision of services, not just psychiatrists, psychologists. Absolutely. And through our platform now, I have the privilege of seeing all 308 registered prescribers. And I can go through there and I can design emails and reminders specifically for those kinds of groups now. I can do it by geographic location. I can do it by specialty. I can do it by practice. And so we're getting really much more facile with our ability to communicate a specific message to a specific kind of prescriber. So one of my goals is to get 1,000 prescribers by the end of this year, and then 5,000 prescribers shortly thereafter. It seems to be increasing, this momentum is increasing. So absolutely we see that. I even know a social worker, she's a friend of mine, Jen Udler, in just outside of DC in Bethesda, and her clients are adolescents, and the therapy is done walking through Capital Crescent Trail, which is a beautiful trail that's like right along the Potomac River in D.C., gorgeous place. And she tells me that the therapy sessions go better when she's outside walking. There's science to that. It's also common sense.
Are there data outcomes on the mental health effects of time outdoors?
There's quite a bit. There's some studies looking at depression, anxiety. I've seen some studies on schizophrenia. So there's a variety of studies. One of the problems that people point out in the research is that because the methodology is all over the map, that it makes it hard, not impossible, to do meta-analyses, systematic reviews, and pull that data together to come out with a little stronger recommendation. So you often hear people say, there isn't enough data out there to do this. And I'm like, the data's right there. Just go outside. I mean, really? You need data for you to go for a walk? Right? I mean, so
we need studies to send people out to go to.
You know, we have a lot of interesting studies. Now, I would say, you know, we do need some studies to look at the prescription, because I do, as we venture more into this, the details of this, we really want to know, you know, the therapeutic index and all the sort of the minutia that's around this, right? And the different kinds of outcomes that occur. But yes, there is quite a bit that's already been looked at in terms of mental health outcomes.
How do pharmaceutical companies feel about this?
You know, I've been asked that before, and you know, no one's you know, put a death threat on me yet. So, listen, the pharmaceutical companies, they're you know, they're making what, double-digit profit margins still. I don't think they care less about this, honestly. The pharmaceutical companies are pretty expert at marketing their drugs, right? So one drug, the purple pill, you know, PPIs for acid reflux, could make billions, and I'm not exaggerating, billions of dollars, right? Probably way overprescribed. I don't think we've prevented millions of cases of esophageal cancer because of the purple pill, right? But great marketing. I think we can learn from the pharmaceutical industry in terms of their ability to educate, maybe not do it the way they do it, but outreach to a potential prescribing audience to get them to understand that this is a good thing to do. So I think there's something to learn from them. In fact, I see a day when park agencies employ community outreach to North Point, to Mayo, to all the different centers around here to educate about the epidemic of chronic disease, to educate about the solution to chronic disease and how to do it through prescription. It doesn't have to be my platform, right? There could be other platforms out there. But that's kind of what I see is that, you know, is the future is learning from why they're so successful and model after that.
Here's a very Minnesota question. How is your prescription impacted by winter?
So I once had a meeting with a walk meeting. I sort of gauge the willingness of somebody to meet with me by their willingness to be outdoors. Like, I'll be at Meridian Hill Park at 12. I'll meet you there. And we had I had a walk meeting with the president of American Hiking Society, which is also the acronym of my high school, Austin High School. And it looked like it was going to rain that day. And I stupidly asked him, should we still go for the walk? Do you still want to have a walk meeting if it's raining? And he said, there's no such thing as bad weather, just bad gear, right? And I mean, you've heard that before, right? So, but it stuck with me. And I live in D.C. I don't live in Minnesota. It's not as cold in the winter, if you're wondering.
To put it mildly.
So, but I get a lot of pushback. A lot of my patients come from the tropics, okay? Jamaica, Trinidad, El Salvador, on and on, right? So, or subtropical or tropics. So they're used to hot weather and they fear the cold, right? But you gotta adapt. We're human beings, we adapt, right? So I work with them and sometimes they come in, it's a rainy day in the clinic. They came to their appointment when it was raining. And they have boots on and they have rain pants and an umbrella and a jacket. And I'm like, you know, so I get pushback sometimes like, well, it was raining. That's why I didn't go to the park because it was raining. I'm like, well, you got all the gear, you know? And I might say to them too, there's a magical thing that happens when you're outdoors and it's raining, right? Why are we so afraid of the rain or the cold? Is it so bad that you might actually sense the cold, the chill on your fingers or your forehead or your eyes? I don't want you to go out those days in Chicago when it was 50 below. Of course not, right? But that's a rare, still today with climate change, that's a rare experience, right? Even winters here. Okay. I'm not speaking from experience. Although I did live in Champaign-Urbana for 1 year, and it was pretty cold there. But my point is that don't let the weather, not as cold as here. All right.
Nice try.
I'm trying. I'm failing. That's as north as I've ever gotten, I think. All right. So.
We'll invite you back next year.
I go to Maine, but in the summer, actually. So, no, but my point is like that's where the doctor part comes in, right? And I say, look, let's talk about this, right? So I don't take no very easily, as you can tell, for an answer. Like we got to do this. And what's the alternative? Depression, anxiety, all this morbidity, hypertension, diabetes. You want shots. You want your leg amputated later on in life. Like what is it like? If you don't change, right, you're going to go down that path. And there are things you can do. It's very empowering as well. So I think there's ways to do it. Programming is fantastic as well. So when you have skiing, when you have outdoor stuff in the winter that you can do, great. It gives people a little bit more comfort that someone else is doing it. They might have an instructor, right? So I think the programming is really important in that sense as well. A lot of folks want a social piece to it. I do not usually. I want to be alone when I'm seeing patients all day. So for me, my lunch break, I want to go as far away from people as possible for an hour. But a lot of folks crave it. They have jobs where they're isolated all day and they crave social and they can do social outside.
You talked about one of the goals of the program to be to bring nature inside, not for wimps necessarily, but people who can't get out. What does that look like?
What does bringing nature look like inside? Bringing nature inside look like? I don't know who asked that, but I might ask you all to ask yourselves that. What might it look like, right? The fact that we have windows in here is in some ways bringing nature indoors, right? Or natural ventilation. I think these windows open. Mm-hmm. Yeah. That's a way to do it. So there's a breeze coming in. I mentioned a living wall, certainly plants. Many structures could have a green roof to them. We're having that conversation right now with Nature Explorer. We have a partnership already with the Nature Conservancy to have a green corridor inside that brings us inside the health center and have some living walls in the break areas. So if you go to the break areas for our staff on the 3rd and 4th floor, I kid you not, and I'm sure this is not an exaggeration, but it's sort of like, this. There's no conversation anymore. Zero, right? So it's interesting. I think that, I'm not a landscape architect. That's not my area of expertise. I've read some of the literature on that, and I would say there's many, many, many ways to do this. I mentioned to you earlier an organization called the TKF Foundation and their program called Nature Sacred. Check out what they have done. Incredible ways of bringing nature closer to us in our daily life. But I definitely think we need to, bring in the designers, bring in the architects, bring in the planners, bring in the contractors and the folks who build these structures, these built structures, so we have more of this and less of what I found at North Point today.
Well, thank you so much for a wonderful conversation.
Are we done already?
Right?
Thanks so much.
Great. Is this on? Robert, thank you. Elisa, thank you so much. We want you all to keep thinking about this. Ask your doctors, next time you see a doctor, ask them if they would start prescribing it, because I do think it really is that intentionality that gets people thinking about the parks. On behalf of the Parks Foundation, our board, thank you for coming. Thank you to our partners, Minnesota Public Radio. We couldn't do this without you. Really appreciate having you here to help us further the conversation. ASLA, and Bar Engineering, and the Lopet Foundation, again, thanks for hosting. And also the Minneapolis Park and Rec Board. because of this incredible system that we have, that you care for, that you program, we're able to elevate it, but we couldn't do it without standing on your shoulders. So as you go forward, make sure you leave our name and numbers. We, the Parks Foundation, is continuing to do more of this. Please consider contributing so we can keep this lecture series alive, and also learn more about, we didn't spend any time talking about our work on the river, but we are trying to create more spaces, especially on the upper river, to connect North Minneapolis and Northeast to more public spaces and parks. So learn more, but thank you for coming. Stick around and visit if you'd like, and we'll see you next year. Thank you.